Hello, today I'm going to talk in this slightly different video about lipedema and its genetics and what that has to do with people looking for a recipe, a magic formula that treats all lipedemas, right? So let's see here if I can. Okay, genetics, great. So here's the thing, I will take an example of a genetic disease. It's not that rare, but it has a lower incidence, which is factor V Leiden. It could be any one. Okay, folks? I don't know if you will remember, but there's that story about big A, little a, big A, little a. So that's the first thing we need to remember about genetics. So when we have the two alleles, big A, big A, little a, big A, little a, little a, little a. What does that mean? It means that this one has both dominants. This one is the homozygous dominant. This one is the heterozygous. And this one is also heterozygous. And this one is the recessive. Some diseases may manifest when you have just a hint of symptoms. Some diseases appear when you have the big A, little a. And other diseases appear when you have the little a. And what does that mean? In factor V Leiden, what does it mean? That this big A is the most severe disease. The big A, little a is the not so severe disease. And the little a has no disease at all. So the big A is rare. The big A, little a isn't that rare because there are these two possibilities. So around 5% of the population will be big A, little a. The big A is much smaller because the disease ends up being more severe. And the little a is the normal population that doesn't have this disease. What does this have to do with lipedema? It has to do with the fact that when I'm talking about a disease like factor V Leiden with a single gene, it's easy to identify this gene. We will take the several DNAs, the chromosomes of different people, and when we put them side by side, we see that it's always the same genetic code that's altered because it's a disease that can only happen there. So, diseases that are less common and are genetic, it's very easy. We take several patients, put their genetic code side by side, and we see what repeats and isn't normal in the healthy population. Well, what's the issue with lipedema? Lipedema is probably several lipedemas within one category of diseases. So why am I saying this? Because the first thing is that it's a disease that 11% of the female population has. It's a lot of people. Let's start there. 11% is a lot of people. It's definitely not just one gene. So when we look at the chromosome, the DNA of people with lipedema and start to compare, we'll see that in one patient, the problem might be here. In another, the problem might be here. In another, the problem might be here. And in another, the problem might be here. And then, despite them, leading to a similar outcome, which is lipedema, let's say, which is the fat deposition in the legs with that feeling of pain, heaviness, and all, their basis is different. So, there's a patient with a problem, one code here, another code here, another here, another here. Well, this way, despite, and why is that? So let's erase this here. When we look at fat metabolism, the metabolism of anything in the human body, normally I'm going to simplify a lot here. It's an event that leads to another event, which leads to another event, the conversion of some enzyme, some protein which then increases some other. And all this in the end ends up leading to fat deposition, for example. So let's go. One gene can act here, another can act here, the other can act on this protein or on this axis here or on this one here. The point is that in the end, the outcome ends up being similar, the increase in fat, the deposition of fat in the limbs. But despite the outcome being similar, we end up classifying everything as lipedema.
Como lipedema,
this one might have a slightly different characteristic from this one, which might have a slightly different characteristic from this one. And the treatment, if we focus the treatment on the final outcome on this here, which is the symptomatic treatment, we might see a partial improvement in all the lipedemas. Now, if we want a better result, we need to first identify these different genetics. That's essential. So if we can identify this one and find the treatment for this one, it might be a very different treatment from one for that one. So even though the outcome is the same, the treatment might not be the same. Even though the disease is similar, the treatment might not be similar. So when we're talking about lipedema, which is a very common disease, 11%, and why do I repeat this? I repeat this because when we look at a disease with a single gene, let's go. Here, that big I, little I mentioned, big I, little I, little a, little I, big I, little I, little a, little I, that's all. Just this affects 5% of the population.
5% da população.
So if we're talking about 11%, I have more than that. It could be this, plus this, it could be this, plus another one. Then I can take another letter. It could be BB, BBB, BBB, BB. It's another gene that acts differently, and all this increases the probability of the disease. So we end up classifying everything in a similar way because it's what we have at hand. That's why there are various types of classification. The classification, we try to classify the diseases to identify which is the best treatment. This applies to all diseases, without exception. So there you have it. So if you see that, let's go. I'm not going to draw that well, but there's the classification of lipedema in the legs, lipedema in the arms, lipedema in the lower part of the leg, and there are several, right? So why is that? This classification, which is not about stages, it's the classification of distribution. It can be involved with the origin. Someone with lipedema in the arm might have a genetic defect similar to others who have lipedema in the arm, but it might not be as similar to those who have lipedema in the legs. So that's why we make the classifications, and I wanted to reassure everyone that despite understanding that you all want to find the solution, the recipe, cake recipe, that will work for everyone, it's going to be very difficult because of that. When we look at the outcome, the symptomatic treatment, it's obvious there are several measures that are plausible and that work for many people, but not necessarily for everyone. So we work with probabilities. So what is the treatment that has the highest probability of working for this patient? We will always seek what has the highest probability. It might not work, but then we move on to a second strategy or even a third strategy. So that's it about lipedema and its genetics and the treatments. Okay? See you next time.